In this video, I am going to go over my top 4 tips for writing the NCLEX in Canada. Tip number 1, study smart. Use multiple American resources. Canadian nursing programs, unlike American ones, are not designed to help you pass the NCLEX. Canadian educators have been getting mixed messages and incorrect information about what the Canadian NCLEX would look like. As a result, we are finding out as our graduates write it what it actually looks like. That means that 2015 graduates are essentially our guinea pigs. Students who have written it tell me that there is American content on the exam. We are told that the Canadian NCLEX will be more Canadian in the future, but I am not going to hold my breath. We are told that the Canadian NCLEX is being revised soon, so educators will still not know exactly what it looks like, but hopefully it gets better with time. In a few years, we should have a better idea and hopefully it will be more Canadian. Until then, you need to study smart. Know both the Canadian and American delegation, healthcare, and measurement systems. One tip from some recent graduates is to study and know generic medication names. If you have any more tips, please post them below. Tip number 2, do questions. American students practice NCLEX-style questions in their programs right from year 1. Most Canadian students are trained to answer a different style of question. That means that you need to relearn how to answer multiple choice questions. The NCLEX also contains alternate formats of questions that you may get. The questions you will get are basically luck of the draw, so if you want to pass it the first time, it is a good idea to practice, and train your brain how to make decisions. The NCSBN website has an affordable option for practice questions that students who have written the NCLEX have found helpful. I recommend that you check it out in the links in the description of this video. Kaplan has a nice decision-making tree that you may want to check out as well. It may look confusing at first, but graduates tell me that if you take the time to understand it, the chart will be helpful. You can also stick around as I make more videos about how to answer NCLEX questions. Tip number 3, learn the American system. Delegation is different in Canada than it is in America because our unregulated healthcare professionals have different scopes of practice. Hopefully, in future years, the NCLEX is adjusted to reflect this difference. But if you are writing in or close to 2015, you should become familiar with what an LPN, LVN, UAP, and NA do, among others. In the description of this video, you will find the link to a book that will help you learn what these people do. I will also be making videos about delegation in America in the future. Tip number 4. Stay confident and focus on one question at a time. When you're in the exam, you need to stay confident and focus on one question at a time. This tip will work for anyone from any country writing the NCLEX, but I mention it here because it is so important. I will explain why in a subsequent video. I hope you pass the NCLEX with ease. I'm starting a video series on the NCLEX that will be helpful to students from any country that will be writing the NCLEX. Please check out the links on your screen and subscribe to be notified when the next videos in this series are released. Thank you.